Hello, everyone, and welcome back to PodBites, where we break down complex medical topics into bite-sized pieces. Perfect for a commute, your coffee break, or whenever curiosity calls. I'm Abdulah Alotaibi, your host for today's episode, and I'm very excited to introduce our new series, Clinically Speaking, where we get a glimpse into the lives of different physicians. Joining me today is someone very, very special, my mother, Dr. Wadha Alotaibi, a consultant and pediatric pulmonologist and sleep physician at King Fahad Medical City. Welcome, Dr.
Thank you, Dr. Abdullah. It's my pleasure to be with you in this podcast.
How are you doing today?
Fine.
Good. So, Doctor, I have some questions for you today. So, for the listeners who may not be familiar, how would you describe pediatric pulmonology and pediatric sleep medicine? Put it in simple terms.
Okay, pediatric pulmonology, it is a part of medical field specialized for the children who is in the newborn and childhood and adolescent, and focus only on the lung, related to the lung disease, developmental of the lung, abnormality in the airway, and the sleep is related to the sleep-related issue, like obstructive sleep apnea, secondary to whatever the cause, the children who have behavioral problem related to the sleep, the one who have attention deficit or hyperactivity related to the sleep.
So, what does a typical day look like at the Children's Hospital in KFMC? And can you just give us, like, for example, from the beginning of the day to the end, what does that look like for you?
You mean about my daily work in King Fahad?
Yes.
Of course, every day is different from the day. Yani let us take normal day. When we join to the hospital, we attend the morning meeting to discuss with the on-call team, which is the resident training. And then after that, either I have outpatient clinic, we'll see our patient in the outpatient, and we'll review the file with the trainee, either resident or fellowship. And then after that, we have inpatient care doing the round, depend if you are on the surface or not. And then also to see the consultation from different departments, either from intensive care unit or from in the ward or in other subspecialty. The other day, if you are not in the surface, you have outpatient coverage, your outpatient, and also you will review the pulmonary function, interpretation, sleep study. But every day is different. Mm-hmm. That's why it's making challenge. So you will not feel it's boring day.
Yeah. So what are the most common conditions you see in your practice?
Different, many cases. Because I'm working in tertiary hospitals, so we say the difficult case, like the child who is born with a chronic lung disease secondary to the immaturity, the child who have a chronic lung disease, either bronchiectasis from cystic fibrosis, bronchiectasis secondary to the immune deficiency, or primary ciliary dyskinesia. And we are seeing children who are syndromatic, they have upper airway obstruction and they need surgical intervention with the help of pediatric pulmonology, or children who have chronic lung disease secondary to the immune deficiency and they need, from our side, bronchoscopy for bronchoalveolar lavage or to do the biopsy.
So among those common cases you mentioned, which of them do you see like clinical mistakes or delays that you wish, never happened?
I wish two things, either from the family or from the physician. From the family, the wrong practice, they are seeking medical advice from different hospital. So like I saw one case, I remember it, and I'm sure I told you before, two cases actually. One case seen in other hospital, and the mother concern is the child have a cough. So cough, and when you auscultate and you will not do x-ray, you think it's simple asthma, and they give him the medication. Then after that, continue medication, then improve the child. Then after a second time, still have a cough, but because nobody go and take a good history, and the child still have recurrent cough, and the mother take the medication from the counter of the pharmacy and she use it. Still, the child is not improving. Then actually, when we receive the child, we do for him CT scan, bronchoscopy, we find it's only simple foreign body. And really, this is a mistake, either from the family, because they didn't say that sudden onset of the cough happening. He was playing, mother was not there, and he was playing with the small toys. If the good physician take a good detailed history, he will reach the diagnosis.
So history is a very important aspect.
Also, another case was labeled in other hospital as asthma, and they do BFT, chest X-ray, and they confirm it is asthma for a long time. Then when it came to us, he have other associated symptoms, like the child have a clapping, failure to thrive. When you do overnight pulse oximetry, there is hypoxemia. So we admit the child and we do for him all this investigation, then turn to be have chronic lung disease related to some disease. And really, because he reached the age of 10 years, and we end with lung transplant. But actually, early intervention, early pick up the case, early diagnosis, it will save the life of the child.
So I would like to also ask, like in the emotional aspect, so what kinds of cases stick to your head to this day emotionally?
You know, it's pediatric is different than other subspecialty, the surgery, other than medicine. But I think OB/GYN and pediatric, it is different. You know why? You will be attached to the child, especially the chronic patient, because they have chronic follow-up in the clinic. So especially when they have chronic disease, so you will follow with the mother as you are a second mom. You will see the compliance, the adherence, and discuss with the mother what the child is suffering, how is his adherence to the medication, and we encourage him in the clinic. So we'll be close together, and he's calling me sometime as a mother. But this will be emotionally attached to me. My patient, I feel I'm their mother. And we review them the daily basic, and I'm sure you know it, and I don't want to cry, but you remember one patient.
Yes.
Especially has late diagnosis cystic fibrosis, and actually we lose this child as I'm losing one of my kids, because she was very close to me, and even in the Mother Day she bring for me. After that I said I should not be emotionally involved, so I will not continue delegate to my friend to see them, because female is different, or the mother is different.
Exactly.
But it's good, I do mean you should not see your patient, but you should leave some time boundary between the patient if you are very emotional.
Okay.
Give me another good question. I don't want to cry.
Okay, so moving on from the emotional aspect, what were the biggest professional challenges you faced, starting, whether it was academically or clinically, and how did you tackle that issue?
Okay, there is 2 points. First thing, regarding academically, when I finished pediatric pulmonology, then I delivered.
Yes.
This Dr. Abdullah.
Sure.
Then after that, I was planning to go to do scholarship for pediatric sleep medicine. And when I get the scholarship, I discover I'm pregnant, and my pregnancy was twins. It was very risky. I delay my scholarship for 1 year until I deliver. Then I go for that. At that time, I feel sad, but alhamdulillah, it was good. But actually, when it is twins, I couldn't go to the state with them. It was a little bit, but the good support for me at that time was my father, Allah yarhamuh, and also my husband. Abdullah was not good supportive because he was hyperactive. He was attached to me. I said how I will handle them, but alhamdulillah, tiyassarat. For administrative, before maybe 10 years, I don't want to show you I'm old. They nominate me to be a head section. I struggle at that time because all in my department are male. And to be a female, it was not all of them is the same, but really I struggle a lot because one of my colleagues, he said, it's difficult for me to be my head section as a female and I'm a male. And they remember how I did with them. I was making more pressure on myself to calm them down. So I take more responsibility. I try to be so kind with them to know female is similar to the male. Maybe she will be more supportive and she will understand if they have social reason, she will be better than you. But alhamdulillah, I hope I'm succeeding that. And the only thing show me I succeeded that. Now still I'm with amazing consultant now. And they said they don't want to delegate to the other than me. This is reward from Allah subhanahu wa ta'ala.
Alhamdulillah. So, Doctor, I would like to ask experiences from your fellowship in Louisville, Kentucky. So, what experiences have you gained from there that you still use to this day?
At that time in 2008, I remember that year, there is no pediatric sleep medicine. There is adult sleep medicine. It was unique subspecialty. It was for me, it is a new era in my field. So when I go there, I learn many things which is new. How to take the history, special history for the sleep, how to deal with the family, how to do sleep study, how to interpret it. I think my kids was with me. It is in two levels. So when I'm taking my kids to the daycare to stay from 7 a.m. until 7 p.m. and they're spending all that in the hospital. So I learn how to take care of the patient, to learn many things. The thing in my mind, how I will open a sleep lab, how I will get new technician, how to train them, how to open the clinic. But I learn a lot of things there. Then I get all their guideline or the application. I hope, inshallah, I try to implement it in my institute and I succeed in that.
So, for medical students or trainees that are considering pediatrics, what kind of personality skills or skills required to be in this field?
Pediatric pulmonology, you mean?
Yes, pediatric in general as well, or sleep medicine.
As I told you when you asked me this question, where you find Abdullah, I will tell you, you are this question you should ask yourself. And my answer for this, all student, they know what they love. Love is very important in life, in your field, in everything. Nobody can enter. Once you love the specialty, go ahead for that. And I'm advising you, don't wait because I love this, I will go. Give yourself a chance. So how you will give yourself a chance? By taking an elective rotation, go to the same specialty you want try to do summer training, communicate with the person who have experience in that field, attend with him either the OR or the clinic, do with him the research, and you will find yourself in that field. If you feel during your practice in the summer, you feel it's boring for you, so that means you are not fit in this specialty. If you spend more than 6 hours on the same specialty and you enjoy every moment, that means, okay, this is my specialty.
You have to go for it, yes. So, can you briefly walk us through your training journey from King Saud University to residency and fellowship and becoming a consultant at KFMC, and what decisions have shaped that path?
Oh, it's a long journey. In medical student, it was very difficult. You know why? Because my father, Allah yarhamu, he was the only one who supported me. My mother doesn't want me to go for medical field. And you know the mentality at that time, because we are from the Eastern province, from Abgeg.
No.
I'm saying Abgeg because Abdullah say, oh, what is this? It's
لا أعرف, I know.
حقل من حقول البترول. Okay. And I have to move to the College of Medicine in Riyadh. So I traveled there. I study medicine, and I was alone. I struggled with difficult, because my English was not that good.
Yes.
And then after that, and I feel alone because I'm doing the medical student alone. Then after that, I love children, and you know that.
Yes.
And even I said when I marry, I will get, inshallah, 7 or 8 kids. Now I get only 5. Time was not helping me. Residency, I enjoy it, alhamdulillah. Pediatric pulmonology, I do it in King Saud University Hospital. Then after that, I decide to go for pediatric pulmonology. You want to make me cry again, Abdullah?
No.
I don't want to cry, please. Abdullah, you know this too. I have my sister. She's another twins. She was with us. She has lung disease problem, not diagnosed. They did for her many lobectomy. And she was squeezing my heart because she was absent from the school many times, not attending with us because of admitted to the hospital. And I told her before when I was maybe grade 11, 12, I will manage you. I will be a doctor. I will manage you. She died during my residency, on the 4th year my residency. Allah yarhamha. Then after that, after 1 year, I specialized in pediatric pulmonology.
Amazing journey.
Alhamdulillah. In Louisville, I told you before about it.
So, for students who 100% want to go for pediatric pulmonology, what route do you recommend? Like, for example, for clerkships or residency, what route do you recommend nowadays?
If you like pediatric pulmonology, go ahead. And before, we are saying it's difficult to do the training here. It's better to do outside. Now we have amazing training everywhere. The chance for them, it's very easy. Important thing, you have to be patient. You have to be a decision maker. You have to be your basic knowledge is amazing. You know how to interpret it. You can see the patient, take the decision quickly for that. You have to have surgical skill to do procedures. You know, your night will be sometimes, especially during your training, it will be miserable because like the ICU, because they will call you for immediate case who have status asthmaticus, hypoxia. Many early intervention in the first 10 minutes is very important. The one who have hemoptysis, you have to go quickly to interfere. Maybe they need intervention. Any delay will affect the child. If you feel yourself, you are energetic and your commitment is high and you are a decision maker, go ahead for that. But before you go for that, as I recommend, communicate with the senior, do elective rotation, make ready your CV, go good research, and this will help you.
Inshallah. Hopefully everyone benefits from the words you've said. So, as a mother of 5, how do you manage work-life balance as a doctor?
Before I will answer this question, I will ask you, what do you think?
It's a very difficult task, I can say.
Lala, what do you think about your mother?
Amazing.
Do you think there is a deficiency? No. Abdullah, say the truth.
I'm saying the truth.
Yeah.
Amazing.
I will tell you something. To make a balance between your work and your home, it's not a matter of equal time. Important is the quality. Okay? And the important thing is, as I told you, and I decide to get children because I love kids and I love my work. And you know what I did for that?
Yes.
And I stay in the hospital, moving our house to the hospital to take care of them. I was a breastfeeding mother, and you know that.
Yes.
Except in the twins. It's very easy. As I said in the beginning, when you love something, you will do something amazing. And Allah subhanahu wa ta'ala, He will give you amazing energy.
Yes.
I'm sure there is تقصير يعني.
ما شفت تقصير. I don't say.
Habibi, I love you.
Thank you.
Maybe in front of them he's saying that. And I feel it is good. And I feel sad when my student or my resident or the fellowship, they said, no, I don't want to marry now. No, time is very important for ladies. And if you select a good husband like your father, he will give you a support. He will be your backup, and you will do amazing. Great.
Inshallah.
And I feel, inshallah, of course, there is some تقصير, لكن الكمال لله.
صحيح. So you contribute to national and regional work on pediatric respiratory and sleep health. Where do you see the biggest gaps in care or knowledge today in Saudi Arabia?
Today, I don't want to be optimistic, but I will tell you the fact. There is no gap. Maybe before 5-10 years, we can say the gap because all the facility now it's available. Research is there. Amazing training is there. Some rare medication or difficult, it's available now. And I think once we have a good graduate from outside and try to implement what they learn outside in their institute, everything was improved. And we noticed that in the last 15 years, especially in tertiary hospital.
It's good to hear. So what areas of research are you currently most interested or involved with?
Usually, my research usually about cystic fibrosis. And because, in King Fahad, we have amazing program. It is national program. It's the only one in Saudi Arabia and even in the Gulf. And is unique to the international. And actually, we arranged for one visitor pioneer in CF to come to evaluate our program. And really, he surprised. It's amazing because all the medication, everything is available. I'm interested in chronic lung disease, and also I have some research about pediatric sleep medicine, like narcolepsy.
So if you could see one major improvement in pediatric respiratory and sleep care in Saudi Arabia, what would that big improvement be that could change, this field in Saudi Arabia to the better?
The good thing is the distribution of the specialized physician in all other peripheral institutes.
Yes.
Yani we don't want to see more condensed physician in one institute when they are available everywhere. So early pick up, early transfer of the case, it will make the care is better. The good improvement, now we can find many sleep physician doctor available. Before it was not there, and they delivering good service. The availability of the facility of non-invasive ventilation, early diagnosis. If you notice in the school, they're opening special class, and we found the special need kids, they have problem, their attention deficit hyperactivity, which is related to a problem in their sleep. So once there is good sleep physician, and now we have also a sleep physician not only for pulmonology, for family medicine, for ENT, for psychiatry, and now in the primary healthcare. So this will manage and improve awareness for the family and closing these classes.
Thank you so much, Dr. Wadha. I hope all the listeners have benefited from the words you've just said.
Thank you. I hope so. Really, I enjoy this. Have a good day.
Thank you.